fight this. We will fight them on this.
Thousands filled the lawn at Queen's Park for a healthcare protest today, demanding the Ford government not make any cuts. Many said they are concerned about reduced funding to public health units. Now, there's always behind-the-scenes politicking going on, and today, believe me, was absolutely no exception. So on the very day thousands are right here on the front lawn at Queen's Park, the Ford government ramped up the rhetoric in its fight with Toronto City Hall over cuts to public health. Now, the city maintains that Toronto Public Health is going to lose $1 billion over 10 years. The Ford government is disputing that, and today, Doug Ford sent a very public letter to Toronto Mayor John Tory saying, and I quote, "We expect you to refrain from further use of misinformation." But it doesn't stop there. Michael Ford, who's Doug Ford's nephew and also a Toronto City Councillor, sent out his own letter accusing the mayor and some of his colleagues on Toronto City Council of fear-mongering and political rhetoric. So, are they trying to change the channel to distract us from this mass protest that was out here today? Well, adding to it, Christine Elliott, the health minister, she gave rare one-on-one interviews today, ramped up the rhetoric herself, and accused the city of mismanaging money.
The municipal government overspent on $10 million, $314,000 I believe it is per year to maintain, and yet these vehicles aren't being used. And the people who are should be driving these vehicles are being paid additional amounts for personal compensation for mileage.
You are escalating the war with the city here, Minister.
I don't want to do that, but what I do think is important, because the people of Ontario expect their provincial government to spend their tax dollars wisely and to spend it on priorities. I think it's reasonable for people to expect that the City of Toronto will do the same.
Toronto Mayor John Tory responded a few hours later.
Last week they tried to say because we had all this money for transit, we should be so grateful we should accept cuts in public health. Today it's a new story, which is, well, because we've had some problems that we've identified and are going to fix with our tree maintenance program, that therefore we should accept cuts in public health. I don't see any of these things as being connected. I think what we really got to answer is, why are they cutting back in public health, and why are they treating Toronto more harshly than any other city in Ontario? Those are the real questions.
And I have one more letter to tell you about. This one signed by 28 mayors across Ontario, including John Tory, and they accuse the Ford government of engaging in downloading by stealth, and they bring up cuts to public health. This is far from over, and the government is going to have to appease a lot of very angry mayors. It's all quiet now, but earlier today, thousands were here on the front lawn of Queen's Park protesting the Ford government, demanding they leave health care alone. The rally, organized by the Ontario Health Coalition.
Solidarity! This is about the health of the citizens of Ontario. This is about our parents, our grandparents, our kids. This is about getting the treatment that we need.
We walk down the halls and there are 5 to 6 patients each floor just outside. They don't have bathrooms. They're not separated from the other patients. It's sad.
Now, to be fair, this has been a problem that's been building, under the previous government.
You are correct, but I mean, we needed some direction for help, and this isn't the direction to send us.
How far will the nearest ambulance be when your loved one suffers a seizure, a stroke, a heart attack, or is involved in a tragic accident? How far will we have to respond to get to your loved one's needs?
Now, Doug Ford specifically, because I asked him about the impact to paramedics on the budget, and he said not a single paramedic will lose their jobs. What is your response to that?
Well, I believe Mr. Ford also said that about the education workers, and we know what's happening in that sector right now. There are job losses happening.
So you're saying you don't believe the Premier?
Well, we're yet to see a plan. We haven't had a consultation yet.
No profit, no greed, healthcare based on need.
I worry about what's going to be left for my kids and my grandkids. They don't seem to care. There's going to be nothing left.
I faced my own health struggles. I have chronic Lyme disease and a few other chronic health conditions. So extremely concerned with everything that's been happening with the government.
It's really a notice to the government that we have done incredible things since being downloaded to our municipalities, that should not be negated and thrown to the side.
So that was a snapshot of the protesters. The health minister says their concerns aren't justified.
What do you say to the protesters who will be out on the front lawn today?
I would say that they have incorrect information. In fact, we are spending $1.3 billion more on health care in this year's budget, and we are spending it to strengthen our public healthcare system. When I hear the Ontario Health Coalition talk about privatization, I really wish they could be more specific with me about what it is they're talking about, because we already have some private care within our delivery system. Doctors who are in private practice, for example, are business people. They are privately operating. Do they want us to get rid of doctors in our system? I don't think so.
Do you anticipate in any way expanding the private delivery of health care?
That is not the primary goal right now, no. The primary goal is to strengthen our public health care system.
The Minister of Health says that the government is spending above the rate of inflation on health care. The NDP strongly disputes that and gives differing numbers. There is a lot of rhetoric on all sides on this issue.